Hi there. My name is Kyla Brady, and I am a pelvic health physiotherapist here at Peach Physiotherapy and Wellness Center. I'm very excited to be presenting on this topic today. It's something near and dear to my heart, something I'm passionate about, and it's called Back to the Basics. What is the pelvic floor, and how can physiotherapy help? So, like I mentioned, my name is Kyla, and I am a pelvic health and orthopedic physiotherapist here at Peach Physiotherapy. I grew up in the Chatham area, born and raised from here, and I was a very, very active kid growing up. I was really into dance, soccer, ringette, running. I still do a lot of these things. So when it was time for me to go away to school, it was only natural for me to pursue kinesiology, which is essentially the science of movement. So I went down the road to Western University, just up in London, and I did that for 4 years. And while I was going through my undergrad, I always kind of knew I was interested in something in rehab, but I never really thought that pelvic physio was going to be what I would end up doing. I was very into sports. I was lucky enough to work with the Western women's volleyball team for a year, and I thought for sure that's what I was going to be doing. So when I was finished my undergrad, I continued on to get my master's of physiotherapy, still at Western, and that's kind of what I was pursuing. As I was looking into more sports medicine, and then I was lucky enough in my first year to get a placement here at Peach Physiotherapy. And I split my time between a couple physiotherapists, one being pelvic health, one being orthopedics. Loved both sides of it, but really, really fell in love with the pelvic health sphere. And the rest was history. Here I am. So after I graduated, I took some more additional learning courses in pelvic health. And I basically started my career here in Chatham. So I'm now working both in pelvic health and orthopedics. Outside of work, I am still quite active. I love running. I love being outdoors. I'm an active member at Blair's Boot Camp, so I do really like group fitness. But outside of that, I like to travel. I like to spend time with family and friends. Just a few pictures here, including my two little cats on the bottom there. I can't do a presentation and forget them. But really, really do love staying active. And this has been a great career for me to be able to do that. So let's continue. I do want to just take a quick second here to run through the outline of our presentation today. So what we are going to go through is, what is pelvic floor physiotherapy? What is the pelvic floor? So where is the pelvic floor? What's the anatomy of our pelvic floor? What's the function of our pelvic floor? Why do we even have it? We are going to look at how the pelvic floor and the core work together. We're going to look at some common misconceptions about pelvic health. And then we'll kind of go into why we should even care about the pelvic floor. Why does it matter? We are going to look at what it is that we treat as pelvic floor physiotherapists. And then we'll finish with a couple things that you can do to support your own pelvic health. So let's get started. Pelvic floor. We are going to start a little bit as to, what pelvic floor physiotherapy even is. So we're going to kind of go into that right now. What is pelvic floor physiotherapy? Pelvic floor physiotherapy, it's a specialized branch of physiotherapy that focuses on the pelvis, the pelvic floor, and basically any conditions that affect that area. So we do both external and internal assessment and treatment of the pelvic floor muscles. And we look at how those muscles are working as an integrated system to then create the symptoms that our patients are coming in with. So we are regular physiotherapists. We do use different exercises, stretches, manual therapy techniques. But when it comes to pelvic floor physio, we're really focusing kind of from the belly button to the knees. Those are kind of the main areas that we focus on. And essentially what we do is we assess our patients. They come on in, we look and see what it is going on, and then we come up with an individualized treatment plan to address those concerns using mainly exercise, stretching, and manual therapy. We focus a lot on education, though, as education is a huge part in all of our patients' recovery, especially when it comes to pelvic health, where there tends to be a little bit less knowledge around this topic. So education is a big part of what it is we do. Now, let's talk a little bit about what the pelvic floor even is. What is the pelvic floor? So I'm going to pull out my trusty model here to help with this. But the pelvic floor is made up of 3 layers of muscles. So this is my pelvis here, and I'm kind of showing you the front of the pelvis. So that's my pubic bone. If I flip it around, I've got my lower back, my sacrum, and my tailbone here. And then I have underneath my 2 little sits bones right there that you feel when you're sitting on a chair. Now, your pelvic floor, if I kind of show the inside, it's spanning from front to back, side to side, right within that pelvic bowl. It's actually made up of 3 layers of muscles. So as we're looking on the inside here, that's the deepest layer of your pelvic floor. And then as I flip it here, we're looking at the more superficial layer. So that one is running right between those legs in that perineal area. So that's kind of where it sits. Now it's made up of 3 triangles, the urogenital triangle, the urogenital diaphragm, and the pelvic diaphragm, just describing some different parts of that pelvic floor, but that's essentially where it is. Now, if we look at some of these pictures on the screen, it's showing you the bony pelvis, where the pelvic floor muscles are sitting within that bony pelvis. And then this picture on the far right is showing the pelvic floor in relation to the pelvic organs. So if I pull those out, we've got that bladder that sits in the front and that urethra right through here. Now for the females, we've got that uterus with the vaginal canal, and then we have that rectum in the back. For the males, we've got that bladder here, the prostate sits underneath with that rectum. And that's kind of what the image on the right is showing there, is it's showing those pelvic organs in relation to where that pelvic floor sits. So if we kind of move forward from here, let's chat a little bit about the functions of the pelvic floor. So like I mentioned, there are those 3 organs, 2 organs in men that sit within that pelvic bowl. The bladder with the urethra, the uterus with the vaginal canal, the rectum, and in men, we've got that prostate that sits underneath that bladder. Now, one of the main functions of the pelvic floor is it does support those organs. And I'm just going to flick forward here for a quick second to show this illustration. So what you should be looking at here is an image of a boat. There are some tethers and the boat is sitting on the water. Now, the boat in this picture is representing your pelvic organs. Those are those organs that are sitting within that pelvic bowl. And the 2 tethers on the side are ligaments that are holding those organs up to the side walls of the pelvis. The water in the bottom is representing your pelvic floor. Now, if we look on the bottom left here, this is showing what happens if we remove that pelvic floor, if we remove that water or that buoyancy. Basically, what happens is the weight of the organs push down on those tethers, so those ligaments need to hold things up a little bit more. Over time, we notice those tethers start to wear out. So it goes to show just how important that support from below is for our pelvic organs. And that's essentially what our pelvic floor does. Now, if we go back, there's several other functions of these muscles as well. If we're looking at our pelvis here, it does provide some stability to a few different areas. So it provides some stability right to our pubic bone on the front, even into our lower back, and then our hips, which sit on either side. So sometimes your pelvic floor is actually associated with things like back pain, hip pain, pubic bone pain. Now, if I kind of bring you this way, that way we're looking at the superficial layer, it does have a sphincteric function. It helps with our continence. So if you can see, it totally surrounds the urethral opening, the vaginal opening in women, that rectal opening, and it does help to control those openings. So if you're having difficulties with leakage, the pelvic floor helps to control that. Now, on top of that, there are a couple other functions we have here as well. It does provide a bit of a subpump action, or it helps with circulation. So as our pelvic floor muscles contract and relax, it helps to circulate fluid throughout our pelvic bowl. It helps to send it back up to the heart to prevent blood congestion or pooling within that pelvis. So that's another role that it plays. And it also does have a role in sexual function. It provides some tone for the vaginal canal, the anal canal. It does also play a role in erection for men as well. So again, just another thing that these muscles do. And we'll scooch on forward. Now, these muscles are pretty cool. They do a lot, but they don't do it alone. They work as part of an integrated network called our core canister. So that's kind of what you're seeing on the left hand of this screen. Now, our core canister is very similar to a house. That's why I have this little analogy on the screen here. Similar to a house in the sense that there's a roof, there's walls, and most importantly, there is that foundation. So let's break that house apart for just a quick second here. So if we look at the roof of the house is representing our diaphragm. On the left-hand side here, you see that the diaphragm is sitting underneath of our rib cage. Our diaphragm is our breathing muscle. So essentially what happens with your diaphragm is as you breathe in, your diaphragm, it's dropping down, your air is coming into the lungs, your belly's kind of expanding. So the diaphragm does all of that. As you breathe out, the opposite happens. Air is expelled from the lungs, your belly comes back to where it was, and that does play into your pelvic floor in the bottom, but we'll get there. Now, let's look at the side walls and the front wall of this house here. That is representing our transverse abdominis muscle. That's this big one that's wrapping around the sides of our body, right from the front and attaching into our lower back. That's one of our deep core muscles that essentially acts like a corset around the body, and it helps to provide some stability to our core. Now, every house has a back wall, and that's what these multifidi are, or the multifidus muscles. Those ones are ones that sit deep within our spine, and it helps to provide some spinal stability. So some of our back muscles are part of this core canister. And perhaps the most important part of this core canister is the foundation. That's the base of the house, and that's our pelvic floor. So as you can see, our pelvic floor sits in the bottom of this system. Now, these muscles do all work together. And as pelvic floor physios, we know that. We know that this core canister functions as a whole. Therefore, what we're looking at is how all of those components are working together. If one of those components is not functioning the way we need it to, that whole canister can break down. So it's quite important to look at the entire picture and how it's all working together. And that's what this is. Okay, so let's take a quick second and check to see if you can connect to your pelvic floor. Your pelvic floor can be activated voluntarily, and there's a few different parts of your pelvic floor that you can activate. Now, you've probably heard of Kegel exercises or something along those lines, and a Kegel exercise is essentially just a term for any form of pelvic floor muscle contraction. So we're going to do what we call a bit of an awareness exercise. So whether it's in sitting, you can stand up, you can lie down, whatever feels most comfortable. But we're going to try to contract a few different parts of your pelvic floor. So I'm going to bring out the pelvic model here, and I'm going to show you a few different parts. So we are going to engage our urethral part, our vaginal part for the ladies in the crowd, and our rectal part separately. So what that's going to look like is urethral. We're going to picture around that urethra, and I want you to imagine as if you have to go to the bathroom really bad and you're trying to stop your pee. So you're squeezing, you're trying to do a little bit of a lift, and you should feel a bit of a contraction closer to the front of that pelvic floor. Now, when you feel like you've got that one, we're going to move to the middle part. So for the women who are listening, this one is around that vaginal opening. So I want you to imagine as if you're trying to hold in a tampon, you're trying to close off that vaginal opening, you're squeezing around that middle part. For the men who are here, I want you to imagine as if you're like shortening the penis, pulling the train back in the station is what a couple of my patients have told me. It's the same idea. We're trying to engage and lift that middle area of our pelvic floor. And then finally, we're going to go towards the back of the pelvic floor. So I want you to imagine as if you're holding in gas, you're stopping a bowel movement, you're trying to squeeze the back part around that rectum. And same thing, you should feel a bit of a lifting of your pelvic floor. Now, if this is easy, you're like, no problem, I've got that, that's just fine. Well, can you do it standing? Can you do it lying down? Can you do it while you're walking? Can you do it in a squat? Can you hold for 10 seconds, 30 seconds? Can you do it fast? Can you do it slow? There's a lot of different ways that we play around with these types of exercises to then tailor towards our patient symptoms that we're coming with. And that's what it is we do with physio. So fun little exercise for you to try, see if you can get that pelvic floor going. Now, let's dive into a few misconceptions about the pelvic floor and pelvic health. Unfortunately, this is a field where there are quite a few misconceptions that a lot of our patients come to us with or that we'll hear out in the community. So let's just debunk a few of these real quick. The first one that I want to chat about are Kegels. The first one here says that Kegels are going to cure all of your pelvic health concerns. So if you have any pelvic health concern, there's a Kegel for that. That's not necessarily true. Kegels, like I said, are a form of pelvic floor muscle activation. Really, really great for individuals who need to strengthen their pelvic floor. Now, just like most other areas of the body or most other injuries or issues, we don't always need to strengthen. And sometimes there are different concerns, especially with the pelvic floor, where people need to actually work on relaxing their pelvic floor. Maybe there's a bit of tension in the pelvic floor muscles. So Kegels can actually do the opposite of what it is we want. And that's why an assessment with a pelvic physio is quite important. Now, let's go to the second one here. Pelvic floor dysfunction only occurs in women. Incorrect. It does not only occur in women. It occurs in anybody who has a pelvic floor. So that's women, men, children. Everybody has a pelvic floor. Sure, there may be some different symptoms from one to the other, but pelvic floor dysfunction can happen in anyone. The last one here talks about urinary incontinence. So urinary incontinence is normal after childbirth and as you age. Not necessarily normal. So I'm going to get picky with the words here. Urinary incontinence is a sign of pelvic floor dysfunction. It is not normal. It is never normal. However, it's very, very common. In fact, 1 in 3 women and 1 in 4 men will experience urinary incontinence, but only about 1 in 12 will actually go chat with a healthcare professional about it. So it goes to show it's very common. Not a lot of people will always go to seek help associated with their urinary incontinence, but it is very, very common, not necessarily normal. Okay, so let's move on forward here. Why is it important to learn about your pelvic floor? As you can tell, of course, I think this is important. This is what I work in. So to me, I'm going to be biased. However, your pelvic floor, it's another part of your body, just like your biceps, just like your hamstrings, like everything. However, like I mentioned, it's not really talked about and a lot of people don't understand it. I am a very firm believer that knowledge does actually help with recovery. Understanding what's going on, understanding your body allows you to seek help if you are noticing any sort of changes and to make sense of what it is that's going on. Outside of that, it's just a very cool body system that is really, really important for us to know about. But knowledge is definitely power. And the more you know about your body, the more you're able to advocate for yourself and the more you're able to find tools to assist with your recovery. Now, the pelvic floor is associated with a lot of different conditions that are also plaguing our healthcare system. These conditions I'm talking about are more pelvic pain related conditions. So things like endometriosis or prostatitis, bladder pain conditions, even lower back pain conditions, they are plaguing our healthcare system in the sense that they are costing a lot of healthcare dollars. Upwards to about $25 million a year go just towards these pelvic related conditions or pelvic floor related conditions. And unfortunately, when people are seeking healthcare or medical care for that, there's a lot of medication, there's a lot of procedures, there's a lot of surgeries that are happening for individuals who may not necessarily need them. Pelvic floor physiotherapy is actually one of the first lines of treatment for many of these conditions when it comes to pelvic pain conditions, back pain in particular, basically anything associated with your pelvic floor. Pelvic floor physiotherapy is the first line of treatment. Therefore, again, knowing about your pelvic floor, knowing about different forms of treatment, and knowing that there are some other options for treatment not only helps our healthcare system, but it does prevent people from having to deal with a lot more invasive and uncomfortable procedures. So again, just a tidbit. It's important to know about the pelvic floor. It's important to understand your body. These are a few reasons why. All right. Now, true or false? We're going to play a little bit of a game here. True or false? On average, you should urinate about 3 to 4 times a day. So think in your mind, how many times do you go throughout the day? Does 3 to 4 seem low? Does it seem high? This answer is actually false. On average, and this is just kind of the baseline, but on average, people tend to go anywhere from 5 to 8 times a day. Now, it depends on how much you drink in a day. It depends on your bladder habits. There's a lot of pieces that play into it. But the typical adult bladder should be able to hold your urine for about 3.5 hours or so. Now, let's go to number 2, breathing. Breathing has an effect on your pelvic floor. True or false? What do we think? So I kind of gave it away earlier when I talked about your diaphragm, but yes, breathing does have an effect on your pelvic floor. Like I mentioned, your diaphragm sits in the bottom of that core canister. Your pelvic floor is down here. So every time you breathe in and out, it acts like a piston with your pelvic floor, draws it up and down and up and down. And individuals who have more respiratory conditions, for example, chronic cough or pneumonia or things along those lines, they actually tend to have higher incidence of pelvic floor dysfunction. If you think about that diaphragm working with your pelvic floor, if something's affecting that diaphragm, it's going to affect that entire system. So breathing does play a big role. Now, the next one, pelvic floor physio can help with pain during intercourse. The answer is yes, it is true. Intercourse does not need to be painful. It should not be painful. And oftentimes when it is, it's a sign that maybe we're holding a little bit more tension in our pelvic floor. And there is a lot that we can do for that. So that's actually called dyspareunia, pain with intercourse. And it's something that we treat as pelvic physios. And the last one, how you sit on the toilet does not affect your ability to have a bowel movement. True or false? What do we think? How you sit on the toilet doesn't affect it. And the answer is false. It does affect it. It very much does affect it. How you sit on the toilet can alter the position of your pelvis. So when we're sitting on the toilet, if we get into a position where our knees are higher than our hips, so maybe our feet are on a stool, a squatty potty, if you've heard of that, one of these little fancy stools, basically what it does is it helps to relax your pelvic floor. Your rectum sits a little bit straighter, things can pass through a bit better. So positioning on the toilet, positioning of your pelvis can actually lead to better bowel movements as well. So little extra information for you there. Okay, so just a quick list here. I've mentioned several different things throughout this presentation that we do treat as pelvic physios. And this is a little bit more of a larger list, but by no means is this exhausted. Anything that is essentially belly button to knees that has some sort of correlation with the pelvis, we do treat and we see. Now, just to name a few here, we deal with incontinence issues, so urinary incontinence, fecal incontinence. Prolapse is a big thing that we treat. It's actually the first line of treatment for prolapse. Pain with intercourse, like I mentioned, or dyspareunia, that is something that we can work with. Sometimes patients with lower back pain, sacroiliac joint pain, hip pain even, there can be a correlation with the pelvic floor. So that is something that we look at. The pelvic floor could be the missing piece in a long history of back pain. We do a lot of pregnancy and postpartum. That's a time of life where that entire core canister does change. And we do a lot of care around those populations. So individuals who are dealing with a DRA or an abdominal separation, labor and delivery prep, we do a lot of prenatal care. Postpartum care, that's a big part of what it is we see, and actually an area of healthcare that is a little bit neglected is that postpartum population. Lots of C-section recovery, we deal with that as well. Like I mentioned, some pelvic pain conditions, things like endometriosis, bladder pain syndrome, interstitial cystitis, male pelvic health conditions like chronic prostatitis, erectile dysfunction. We see a lot of men post prostate removal. Vaginismus for the women, some spasms within that vaginal canal. That's something that we deal with. Vulvodynia, so changes in sensitivity within the vulva. We even deal with different autoimmune conditions, kind of like a lichen sclerosis. That's something that we will see, and many more. Like I said, this isn't an exhaustive list, but we do treat several different conditions. Okay. So now that we've gone through all of that, I do want to leave you with just a few tidbits, some things that you can do to try to support your own pelvic health. Number one I have on there, like I mentioned, learn. If you found this presentation interesting, if this is something that you don't really know a whole lot about, look at some resources, read, ask questions, reach out. The more you know about the body, the easier it is for you to understand. And that is actually step one on your road to recovery. So if you're having any sort of symptoms, the more you learn, the more you know, the better you're going to be able to take care of yourself. The next one I have on there is staying active. Now, of course, I'm biased. I'm a physiotherapist, but movement very much is medicine. And there has been a lot of good evidence to show that mild to moderate intensity physical activity can reduce your risk of developing urinary incontinence. It can help with pain conditions, any sort of pain conditions. Mild to moderate physical activity has been shown to be helpful. It leads to better pregnancies. It leads to better pregnancies and recoveries for both mom and baby. And it really reduces the risk of a lot of the complications that may happen during pregnancy, during labor, during delivery. So there's a lot of benefit of staying active. So that is actually a way that you can support your own pelvic health. The next piece I have on there is active recovery. And by this, I mean, focusing on what it is will actually make you better, trying to get to the root cause of why you're having symptoms. In the clinic, especially in the world of pelvic health, there are a few different patient populations and three main patient populations that I tend to see, or patient mindsets, I should say. Those who have symptoms and ignore it, so they don't even want to deal with it. That's just something that's going to go away. Those who have symptoms and they essentially arrange their life around it. So maybe they take medication. They are constantly wearing pads. They stop doing activities they used to love doing because of leakage. Maybe they've stopped jumping on the trampoline with their kids, or they're not running anymore. They're not going to the gym because they have issues. That's kind of, organizing your life around those symptoms. And then finally, there's this third group of patients, and these ones are the ones who do really, really well. And those are the ones who understand that there might be an issue. They want to get to the root cause, and they are very active in their recovery. They're proactive. They reach out, they get help, and they really try to deal with that root cause. And that's a very big part of supporting your pelvic health. And last but not least, reach out. If you're having symptoms, if you need some additional help, seek it. Reach out. Even if it's something as simple as talking to your family doctor, you can talk to any of your healthcare providers about your pelvic health. You can ask about pelvic physiotherapy. You can get their input. You can look at different treatment options. But if you are noticing symptoms, reach out and see what it is there is that you can do. Okay. And that brings us to the end of our presentation. Thank you very much for listening. I hope you learned something. I hope there was something new in this that you can take out of it. And if at any point you do have any sort of questions or you want to reach out, my contact information is right here. So I'm at Peach Physiotherapy. My name is Kyla. My email is there. Feel free to reach out. But I hope you learned something and you have something to take away from this. So take care. Thank you very much. And we'll talk soon. Bye.